Welcome everyone to the first of a couple webinars that we're presenting to present and answer questions regarding the nurse practitioner training program. We're represented here today by me, Sandy Oster, from the University of Auckland, and by Deborah Gillen from the University of Otago, and Betty Poot and Kathy Holloway from Victoria University of Wellington, as well as Janae Volk here at the University of Auckland. I'll start with a brief mihi whakato, and we'll introduce ourselves, and then we'll get started with questions. Kia ora tātou, ko Sandy Oster toko ingoa, no Minnesota aho, I mahi ana haho, kei te wananga o Waipapa I roto I te School of Nursing, tēnā koutou katoa. Welcome everyone. Deborah, would you like to go next?
Tēnā koutou katoa, ko Deb Gillen toko ingoa. Hello and welcome everybody. My name's Deb Gillen. I'm a nurse practitioner in gerontology and the academic lead for the Master of Advanced Nursing Practice degree at the University of Otago, Christchurch.
Thank you. Betty?
Kia ora tātou, ko Betty Poot aho. Welcome everybody. My name, I'm a nurse practitioner that works clinically at the Hutt Valley DHB, mainly in respiratory, and work at Victoria University as an academic, and I coordinate the NP practicum for Victoria University.
And kia ora tātou, ko Kathy Holloway aho. I'm the director of the School of Nursing, Midwifery and Health Practice and work here at Victoria University.
Kia ora. Janae?
Kia ora, ko Janae Volk toko ingoa. I am a nurse practitioner at Starship Community in Auckland, also an academic mentor on the Auckland University NPTP program. Welcome.
Welcome everyone. Now, in this webinar format, the participants are able to ask questions using the question and answer bubble that's available on the bottom of the screen. So please feel free to put questions in. We'll start with just a very brief overview on a few, I think, really relevant questions, and then we'll address your questions as they come. I'm going to start firstly by reviewing the nurse practitioner training program. The nurse practitioner training program was developed about 5 years ago in recognition of the need for further coordination and support for nurses when they finish their nurse practitioner educational training, to coordinate with the Nursing Council for registration, and a chance to provide increased financial support to nurses who are participating in the practicum year, as well as to clinical areas to support release time for nurses as they complete that practicum year and are increasing their skills. The Ministry of Health has funded the nurse practitioner training program as a national program now, and we have 50 places each year for nurses in the nurse practitioner training program. Nurses may nurses apply to the nurse practitioner training program through the application process, which you will be familiar with through this webinar, and they apply to the university of their choice from the 3 participating universities, the University of Auckland, Victoria University of Wellington, and the University of Otago. The applications are open now until September 10th. Once the application process or applications close, we will look at all of the applicants, and then there is an interview process that's set up to interview applicants before we make the final decision regarding places. And we anticipate that that will be late October when that occurs, but we'll keep people posted around that timeline. So what is the nurse practitioner training program? And are you ready to participate? Is one of the questions we get a lot. There is three really domains that you need to consider for your readiness. It's the academic preparation, and we'll discuss that at each of our institutions briefly, that is considered. There's also the clinical preparation and employer support, which is quite essential as a nurse if you're preparing for a nurse practitioner role. You need to have developed your clinical expertise in your area of practice and be working as a senior nurse in a senior nursing role that's directly patient facing and focusing on developing your skills in diagnosis and treatment for patients, because that's really the skill that nurse practitioners are adding to their already advanced nursing skills. Your employer needs to support you as you go forward, and as part of the application process, we ask your employer to commit to supporting you for 2 days a week, or approximately 16 hours per week of supernumerary placement. And there is financial support for the employer as you do that as part of the program. They also need to agree to hire you once you've completed the program and are successful with your nursing council panel interview. This is really important because once you have developed and achieved nurse practitioner status, you need to practice as a nurse practitioner to consolidate those skills. And then the other really important consideration as you consider whether you're ready for the nurse practitioner training program is, have you considered and do you have the support of your whānau and family? The nurse practitioner practicum year is very full on in terms of your time commitment to both study and clinical work. And it's important to make space in your life and in your time in order to be able to commit to that study over the practicum year. And we can talk about that further. I think to get some input from others, Deb, would you be willing to discuss the academic preparation and process at the University of Otago? And then we'll ask Betty and Kathy to do that for Wellington, and I'll do that for the University of Auckland.
Thank you, Sandy. So at the University of Otago Centre for Postgraduate Nursing Practice, the nurse practitioner papers, the papers that are funded via the nurse practitioner pathway sit within the Masters of Advanced Nursing Practice degree. So this is a specific degree leading towards nurse practitioner qualification. The two specific papers are the Nurse 434, Therapeutics, Knowledge and Integration. So that's the nurse practitioner prescribing practicum. And the second paper is Nurse 530, which is the nurse practitioner final practicum paper, which brings it all together. So these two papers form the final year of your degree if you're undertaking the full nurse practitioner degree program, or the two papers can be undertaken separately post a master's degree, provided you meet the requirements for entry. That's probably us in a nutshell, Sandy.
Thanks, Deb. Betty and Kathy.
I think Betty is the expert here, so I'll let you talk to that.
So at Victoria University, the NP practicum is usually done at the end of the masters, but can be also done post masters. Our paper is a 60-point paper, and it's taught across 2 semesters. The entry requirements to get into this paper is we require a B grade in the core courses, and those core courses are our assessment paper, diagnostics and pharmacology paper. Anything else to add?
No, I think that's pretty clear. I think there's quite a clear pathway into the practicum paper that we're happy to talk through with anyone who has questions.
Thank you. At the University of Auckland, the practicum year, which is what the nurse practitioner training program entails, it's that final practicum year, is 2 30-point courses, Nursing 743 in semester 1 and Nursing 740 in semester 2. That 60 points needs to be completed as either the final year of your master's program or after your master's is complete. And we have about half students who do at the end of the master's, and about half of our students do it after their master's is already complete, when they've had some further time to consolidate and develop their clinical practice so that they're ready for the nurse practitioner practicums. Deb, there is a question from somebody about the University of Otago. Are you able to see that question?
See that, yes. So usually the nurse prescribing diploma is completed as a diploma, so that's 4 papers. It includes the core concept papers of advanced health assessment, prescribing and advanced pathophysiology, along with your prescribing paper. And provided you have met the B grade average, you can apply to come into the Masters of Advanced Nursing Practice, and you would have 4 more papers in order to complete. And it would be good to talk with, it looks like Andy, is it? Individually, Andy, to know which specialty paper we would be wanting to advise you to undertake as part of that final 4 papers. So unless you've got additional papers, you wouldn't be quite ready for the nurse practitioner training program just yet, with only 4 papers and a diploma. But we encourage you to get in touch, and we're happy to talk further about your individual pathway.
I see that she's responded again, Deb, saying that she has completed the Master of Nursing and all the prerequisites. So,
okay, so it'd be good to talk with you, Andy, as an individually, to look at which papers you would need to do. It may only be a 30-point final paper, but you'd also be eligible to apply for the nurse practitioner training program by the sounds of it. It would be good to talk with you individually.
great, thank you, Deb. All right, the next thing that I thought we would talk briefly about is just the application. If you've found the website that had the information about this webinar, then you've found the information there around the application. The application will require you to have a letter of support from your employer, and there's a template for that letter on the website in the application site. It'll be helpful for you to review that with your employer and gain their signature. Also, you'll need to have a conversation and find a senior doctor. That might be a GP if you're in primary care, or a senior medical officer in secondary care, or a nurse practitioner, to agree to be your clinical mentor supervisor for the practicum year. That's an important conversation to have with them, because they're committing to spend regular time with you, working alongside you as you see and assess and plan the treatment for the patients you're seeing. And this is for 500 hours over the year. Again, it will average 16 hours per week. There's some flexibility as you plan in terms of how you will manage that with your mentor, but the time commitment is a regular time commitment. They do need to be on site with you and directly supervising your practice. So it's important to help both of you understand the time commitment that you're making. There is the need to have a referee as part of your application. We want you to have a conversation with a nurse practitioner if you know and work with one that's really useful, or another senior nurse or doctor that you work closely with that's able to provide conversation around your readiness for nurse practitioner preparation. So it's important to have someone be a referee for you who is familiar with you and your practice skills as you apply. Deb, do you want to talk briefly about the difference between the nurse practitioner training program funding and the health workforce funding?
The health workforce funding is something we encourage participants to consider applying for via their individual DHB and supporting organisations. The nurse practitioner training funding is definitely significantly more generous. However, there is only the 50 places available, and it is pretty competitive. So we do encourage you to apply. The difference primarily is around the numbers of hours in the practicum that are funded via the health workforce pathway. So that's reduced from 250 via NPTP to 150 per 30-point paper. And Betty, you might want to chip in there and talk about that in relation to Victoria, because you've got a 60-point two-paper path or single paper pathway.
Yes, so the difference between the NPTP funded student and the non-NPTP funded student is similar to yours. It's just the hours would be 300 for the non-NPTP funded student, and the clinical hours requirement for the NPTP funded student would be 500 hours across the 2 semesters.
I think the other thing that's perhaps relevant to be aware of is that the funding flows via your local DHB to the student and the supervisor for replacement funding and for supervision, rather than through the university process. So that's quite a different process of organising, and it's an individual thing that you would undertake as an individual student. But we certainly encourage you to make that application at the same time in most areas as you're applying for the NPTP funding, because they tend to be pretty much simultaneous in terms of the application. Sometimes the timing of letting you know whether you've been successful in one or other might be slightly different, but you can always get back in touch with the, if you're lucky enough to get into the NPTP, you can always let the health workforce funding know that that's been successful, and then they can reallocate that funding. I think those are the main pieces.
Another question has come through from someone who has started their program with another university, not one of the 3 universities that are involved in the nurse practitioner training program, and they wonder whether they're able to move to one of the participating universities in order to complete the NPTP. That is possible. It will be important for you to contact the university that you wish to move to and discuss how that may be accomplished. I know for the University of Auckland, we are happy to transfer in completed programs such as a PG cert or PG diploma in as recognition of your study as you apply to the master's, but it would require individual advice. So please, on the website, there are email contacts there. Click on that and ask that question of the university that you'd like to study with. Melissa's asked a question. I already have my master's degree and work in primary healthcare as a nurse prescriber. Can I apply? The answer to that question is, it sounds like you can. If you have met the prerequisite courses and you have your master's and you're working within primary healthcare, it sounds like you'd be a great candidate. Good. There was another question over in the chat function that I'll just try to address here now. Someone has a master's from Grand Canyon University. Can you cross-credit this program? I'm assuming the Grand Canyon University is in the United States. And so if that's the case, that'll be an international qualification. Again, the best way to answer that question is for you to contact the university that you would like to study with, and we can look at that qualification and discuss how that might be able to be recognized in New Zealand. Another question has come through in the chat. If you've completed a clinical master's and working as an RN prescriber, does this reduce the hours or papers needed? I'll answer for the University of Auckland, and then Betty and Deb, I'll ask you to answer for Victoria and Otago. The University of Auckland, our program requires that if you've completed the clinical master's and if you're working as an RN prescriber, then you have completed the prerequisite courses, because the prerequisites are very similar. The nurse practitioner training program, though, requires the entire year, the 500 hours. And we have had nurses who are RN prescribers complete our practicum year, and all of them have agreed that having the benefit of the entire year has been useful as they change their scope of practice from RN prescriber to NP.
And that would be exactly the same for Victoria University.
And in Otago, we would encourage participants to do the full year, as Betty and Sandy have talked about. There is the opportunity, however, to have an individual assessment to discuss whether or not the completion of your nurse prescribing practicum is able to contribute and reduce the final year practicum to one 30-point paper, but it would need to be an individual discussion and a conversation that we would need to have.
Great, thanks, Deb. All right, there are no other active questions at the moment. I thought we could talk further now on, again, how to prepare as you develop your application. The nurse practitioner training program, if you apply and are successful, will begin in early February of 2022. What should you be doing now? Well, in order to really gauge your readiness and preparation, you should definitely be in a patient-facing role now. Do you run a nurse-led clinic? If you don't, and that's a possibility, that might be something to consider in your role, but this looks different in different areas of practice. Are you in a senior nursing role or a nurse specialist role? Often those roles will allow and facilitate you to be having the kinds of patient interactions that are going to help prepare you. Are you confident with your physical assessment and physical exam skills? This is an important one to just revise those skills. All of you will have completed an advanced assessment course. You'll definitely use those skills in the nurse practitioner practicum year, so it'll be really useful to continue to upskill. If you're able to work with your employer so that you are seeing patients and working alongside your mentor as soon as possible, that will be useful. There won't be any funding facilitate 16 hours a week before the program starts, but if you can start to work towards positioning your practice to work alongside your mentor so that you can start gaining those assessment skills, developing patient presentation skills, how to articulate and present your patient, and then the clinical decision-making skills around developing a diagnosis and what treatments are needed. Another key thing that you need to consider, and you can start to develop now, is what are the conditions that you're going to treat as a nurse practitioner? What is your area of practice? You need to become really comfortable and confident with all the different kinds of presentations that patients make in your area of practice. For example, in primary care, this is really rather large. and I always am amazed by primary care nurses. Really, you have to manage anything that comes in the door because that's what primary care is. So start to work through what kinds of patients you're developing comfort and what conditions you're developing comfort seeing. If you work in a specialty area, I might ask Betty if she's willing to talk about what to do to prepare to be a nurse practitioner in specialty practice.
So I think it's all of what you've commented on, Sandy. So getting yourself into a position where you may be doing nurse-led clinics and having the mentor available, and working on those patient assessment and physical examination skills and getting those absolutely down pat. But I think it's also about ensuring you're broadening your practice. So thinking much more widely than the sort of area you work in. So for example, if I use myself as an example, so I work in respiratory, but it's you have to, as a nurse practitioner, you have to think much more broadly than just respiratory. So you need to be very comfortable with all the conditions that respiratory patients may present with in your practice, and be able to manage those, or think of who could, or recognise what's abnormal. So it's really broadening your base. Because that's what a nurse practitioner does, is a broad practicing but advanced skilled nurse. I hope that answers what you were thinking, Sandy.
Yeah, that's great. Janae, do you mind talking about your area of practice and preparing for that?
Sure. So as I mentioned, I work at Starship Community, so I have a child and youth focus. But like Betty said, it's very much about having broadening from that scope as well. So it involves being able to straddle both the secondary care side of health as well as primary care and everything that comes in between that, but also for a child and youth focus is also being able to look at the family as well. So often there is a lot of crossover into managing parent health as well, that then supports whānau health. So it's really moving away from just I work with children to working across the healthcare spectrum and across the whānau spectrum as well.
Thanks, Janae. Deb, do you mind talking about your area of expertise?
Thanks, Sandy. Older adult health is like primary care, quite a broad area of health. The areas that I feel that nurses need to think about are around being prepared to work across the spectrum of older persons. So that's community, age residential care, and also in acute care settings. So we couldn't, as an older person's nurse practitioner, I can work into any of those areas, and I need to be able to think about treating not only chronic long-term conditions, but subacute and acute presentations as well. And that, I guess, pretty much covers the gamut of many primary healthcare presentations. So there's specialty things that we think about with older adult, particularly in relation to cognitive impairment, depression, delirium. There are some of our core business, if you like, as well as thinking about the context in which the older person lives and it carries out their daily activities. So a bit like Janae, I'm thinking about the carer support needs, what's going on around the older person, thinking about that broader health perspective, not just the physical health of the older person, thinking about their social, mental health. So that's that broad context of care. So yes, it's very broad. For myself, it's not defined purely by age, because aging affects us at different rates in terms of I'm thinking about equity here. And you know, in my own practice, I would see people from usually around 50 up to around 100. So, you know, it's a large population group if we're defining purely by age. My current practice for myself is in the community, but I would go into age residential care sectors to see people that might go into respite care, or I might go to see somebody who has transitioned into age residential care, as well as I may admit into acute care, and I would follow the person up into the acute care setting. So it's diverse, but it's a very interesting role to have.
Thanks very much, Deb. I agree. That's why I think most of us became nurse practitioners, is because it's so rewarding to be able to follow up and follow through with the care of the patients we're taking care of and provide for both their psychosocial nursing as well as their medical needs. We have a question from Kristen that's, with broadening area of practice in the 16 hours, would supervision across the specialties be okay to arrange? For example, I'm a cardiology nurse, but I wonder if having supervision from a medical physician and the cardiologist is what can be considered, or do we just arrange the 80 hours with another supervisor? I'm happy to address that, and then Betty or Deb, if you've got any further thoughts. It is important because a nurse practitioner is it's a new scope of practice. So it is important that you have skills that translate across sectors and not just purely in your specialty. Of course, you'll be an expert in your area of specialty practice, but it would be useful for most nurses to spend some time working with a respiratory nurse practitioner would probably be what I'd recommend, or in diabetes, or in another area that's relevant to your practice. The second, what you also have alluded to, is the 80 hours of secondary placement. It's important to consider that before you start the year, but we'd really like the opportunity to work with you once you're in the program, once you've established your primary placement, about what would be the most suitable secondary placement that broadens your skills and takes into account your strengths and areas for development. Any other thoughts, Betty or Deb?
No, I think that you've said it really nicely, Sandy. It's really important to broaden, not just focus on cardiology per se. You need to be thinking about what are the people bringing, what are the patients coming with that you're going to be seeing. And respiratory or general medicine is a good broad area to think about in regards to supervision. Sometimes people do have more than one supervisor to enable. In the area that I work, I might have a supervisor across 2 areas, but that needs to be quite carefully thought through, and it needs to be quite a firm arrangement, I guess, in terms of who's taking the lead role in that situation. So whilst we do have those situations, we encourage usually people to have one single supervisor where possible.
I haven't anything further to add. Do you want me to move on to the next question, Sandy?
Sorry, my internet connection was just wobbly and I've tuned out and on back in. Do you want to address that question?
Yeah, so Andy's asked about working in primary care in a PHA. What's your recommendation when working in GP land? I guess if your question is about the clinical supervision, it would be important to work with somebody who's working in your practice to have that clinical supervision, and that can be either a medical doctor or a nurse practitioner if there's one in that practice. Working in primary care, you need to think about how the clinic template will look and how you're going to structure your day with being able to, tap into your clinical mentor for support and sort of the time frame that you're going to be given to be able to see those patients. So there's quite a bit to work on around that. You would also need to have a second mentor, a second clinical placement of the 80 hours. As with the previous conversations, it's probably important to discuss that with the academic mentors to see what would be the best place for you to go to. I mean, I think that's more done as an individual, but you need to think about what area you have gaps in, to think about what area you need to upskill in.
Betty, there's a second question about working in primary health care. So if we work in primary health care, it is the case that either a GP or a nurse practitioner in your practice would be your primary supervisor. Your secondary practice, would it need to be in a hospital? For example, going to work with Betty.
So it doesn't have to be in a secondary care placement, and that's probably why it's better to have a think about where your gaps in your knowledge are on where you see that you need to upskill, and then work on a secondary placement in that area. So it doesn't have to be in secondary care, but you don't want your second placement to be exactly the same as your main placement. So yeah, I'm always willing to upskill people in respiratory.
Thanks, Betty. Andy is planning on working in rural practice, and there are some specific challenges to getting the mentorship you need when you work in a rural area. There are lots of challenges to working rurally in New Zealand that come across. So it sometimes is important to be quite creative and see where we can find an appropriate setting for you to have that support. It is the case that you may have to go work in another practice if there is no other, if you're sort of a solo practice nurse out there on your own with people only visiting occasionally, that may not be enough support. And so it's great to start having conversations with your employer about what other possibilities there might be, and that those practice hours with the nurse practitioner training program, there is some financial support to facilitate perhaps going and working in another practice for a period of time in order to arrange that, that support that you'll need. And yes, there is some resistance to NPs in some areas of primary health care, but thankfully that resistance is going right away. It was definitely the case 10 or 15 years ago, but it's been really amazing to see once practices start working with nurse practitioners, they see the value of that in practice and are absolutely willing to support. All right, the next question, working in brain injury rehabilitation, not sure how I can choose the secondary placement. I'm not aware if we have another NP in this specialty, so not sure how my role would look. That's a challenging one, Shalyn, because it is important to work through with your service what would be the role of an NP in your area of brain rehabilitation. Are you working in the acute rehabilitation setting within a DHB? Are you working with patients as they're out in the community? The role of a nurse practitioner is primarily a clinical role. So is there support for you to see, assess, and evaluate and support patients as they progress through their rehabilitation? You're right, I'm not sure I know of another nurse practitioner who works specifically with brain injury rehabilitation, but there are other nurses who work in specialty practice that might be a good place to start with talking with a nurse practitioner, say in a cardiology practice or another practice that might have some aspects of acute as well as community. Other thoughts, Deb or Betty?
I'm guessing, wondering what your service would see as the focus of a nurse practitioner role, as well as what you see as your role. So thinking about what would be different that would be offered in that service by a nurse practitioner that, for example, would be offered by a clinical nurse specialist. So how would those roles differ, and being able to define that difference, I think would be a really good place to begin to start. You might think about broadening your practice in neurology or in more general or in more general rehabilitation concepts. Again, it probably requires some individual conversation around your background, your previous work, and where this role is likely to progress and develop. I suspect that purely brain injury might be quite narrow, Sandy. This might be might need to be broadened a little bit further.
I agree. It is important, and we can get really locked into our workplace role and what we're doing when that's quite narrow. And as you become an NP, it's important really to stand back and say, what would an NP do in this service? What value could I add if I was an NP into this service? And Deb's quite right, that really does require starting with some thoughtful individual conversations with your nurse leader, with your service manager, and others to see what that might look like. All right. Ravi asks, what is the scope of nurse practitioner in mental health and addictions? Well, unfortunately, we don't have any of our mental health and addictions NPs who've joined us today, but there is a scope for a nurse practitioner in mental health and addictions. We have, I think there are more than 20 nurse practitioners who practice in New Zealand in a scope of mental health and addictions, and it may be more than 30 if I recall. There are 2 nurse practitioners that I'm aware of who practice primarily in addictions, and the rest practice mainly in a community role, is where the nurse practitioners tend to aim their practice, working with people out in the community as opposed to acute mental health, because acute mental health tends to occur. Those patients come into a DHB where there are other medical providers available. It doesn't mean that a nurse practitioner role couldn't be developed. It just hasn't occurred there yet. So nurse practitioners working in mental health tend to work in secondary and community services. There is quite a lot of interest from the Ministry of Health and with our program to develop further skills for nurses working in a mental health scope of practice that potentially even reaches into primary care in order to support primary care to work with patients to support their mental health needs. Now, I think I may have frozen up.
You're still going.
There, okay. Not sure if people were able to hear my full response or not.
Yep, we did, Sandy.
Okay, thank you. Are there any further questions from anyone? Well, not seeing them, I think, here we have. Someone is doing a master's from EIT in Hastings. We do work with EIT for students who are there, if they're completing their studies. There are several students who study with EIT who are completing their nurse practitioner practicum with Victoria University in Wellington this year in that program. That's certainly an option to consider. But again, if you have specific questions about your studies, by all means talk with the program at EIT, but you're welcome also to contact any of the participating universities to discuss continuing your studies with one of us as part of the.
So if I just comment there, at Victoria University, we have several students completing the NPTP who have done the majority of their studies through EIT. So I'm more than happy to talk to you individually about that. Or the other person I'd suggest you talk to is Rachel Walker, as she'll be able to give you some really good advice on your further studies, and particularly if you want to apply for the NPTP program.
Okay, I'm back. Sorry, Zoom and internet connections. Does anyone else have any further questions?
There's a question in the chat, Sandy.
Okay, is it the question about doing a master's at EIT?
No, so Anna has asked in the chat, is there any comments in relation to the case study in demonstrating a systematic approach to a typical patient encounter?
Well, feel free, Janae, if you.
Yeah, so are we talking about the case study that you submit as part of the application? Yeah. Yeah, so I think it's good to be thinking about cases that potentially will showcase where an NP role might fit. So patients that do have a layer of complexity as such, and that can demonstrate where a nurse practitioner role will be beneficial. So as we've all talked about, you know, what our NP roles kind of look like and how we've broadened, I would take the word broaden and start to apply that to some of the cases that you're thinking about. And definitely demonstrating that systematic approach, but also, where the NP role will fit in. So especially if you're coming from a role where you are already in a senior position or you're a clinical nurse specialist, we want to see how that could expand and where your thinking is around moving broader than your clinical nurse specialist role. So yes, systematic approach, but also a nice broad thinking about your NP role approach, if that makes sense.
Great, thanks, Janae. All right. Well, I think I'll go back to our panelists is there anything else that you'd like to add as we wrap up in the absence of any other questions?
Just like to encourage anybody who's interested to get in touch. I can see Amy's put the link up on the chat site there to the website with all the details, and you'll be given directions to contact or be contacted by one of our staff to have an individual conversation. So we're very happy to talk with you about your plans. It's very exciting to be thinking about the nurse practitioner training program in particular. And if you want further information, don't hesitate to talk with us.
And that would be the same from Victoria University. Please do either contact myself or through the website. There's an email address to contact the School of Nursing here at Victoria University, and then we'll get back to you and answer your queries. And
I just wanted to add congratulations on thinking about this important next step. And whatever your pathway is, best of luck.
Thanks so much. Well, thanks everyone for joining us. This webinar has been recorded and we'll be putting it up on the website so people can have a look again if there's other information they'd like to review. And we will be doing a second webinar in August, and the details are on the website for that webinar. Please feel free to share this information or the website with any of your colleagues who might be interested. And we'll look forward to meeting you during the application and interview process.